Nearly all of us have taken antibiotics at some point after getting sick.
Well, you know, if you have, they've helped treat some type of bacterial infections to help you get better.
But doctors I spoke with are growing concerned over how much we use antibiotics. All new tonight at 10, we take a closer look at the growing number of unnecessary prescriptions and the unintended consequences they could bring. If you've ever had strep throat, whooping cough, or a UTI, antibiotics probably helped you get back on track. For Amy Henson, they made all the difference.
As a child, I had strep throat probably 6 times a year, so I would constantly be on and off of antibiotics. It was consistently responsive, and it was usually amoxicillin that I would take.
Antibiotics helped treat her illness, but taking them for an extended period of time led to severe problems.
I started having gastro problems on and off, and eventually couldn't keep any food down. From there, I went to the ER and they tested me for C. diff, and I was positive.
C. diff is a bacteria that can cause an infection after you've taken antibiotics.
It kills off the good bacteria. That infection from overuse of antibiotics kills about 13,000 Americans each year.
Dr. Naveen Patil is the infectious disease medical director at the Arkansas Department of Health. He says C. diff can occur even when taking antibiotics properly. But taking them for an extended amount of time or improperly heightens the risk.
You don't treat an infection for 15 days when you only need 3 or 5 days.
A 2018 CDC study found that Arkansas is one of the top prescribing states in the country. Dr. Patil takes it a step further, saying our state has an over-prescribing issue.
Every citizen gets one. So not everyone might get one, but what I'm saying is you might get 2, I may get, it averages out to 1 prescription at least.
He's hoping those numbers go down and antibiotics are only prescribed when they are truly needed. Not only to limit complications like C. diff, but more importantly, bacteria are growing more and more resistant.
CDC estimates, almost 3 million drug-resistant infections occur each year in the US. And from these, there are about 35,000 untreatable infections from which people die.
The CDC says antimicrobial resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. The agency describes this as a, quote, urgent global public health threat.
Staph infections, whether it's staph skin infection or bloodstream infection, those are important infections. And most of the staph infections have now become resistant to commonly used oral antibiotics.
It's not just staph infections that have grown resistant. The CDC's 2019 antibiotic resistance threat report also lists the bacteria that causes pneumonia as a serious threat.
2 weeks before school was out, I went to the doctor, and it was just thought to be a cold or sinus infection, and I received an antibiotic, which was a Z-Pak.
Risa Nettles, a teacher at Pulaski Academy, says the Z-Pak wasn't working the way it should, so she went back to the doctor.
And I asked this time to have a strep test. Strep had gone around the school, to have a flu test, and to have a COVID test. I also asked to have chest x-rays.
Turns out she had pneumonia, and doctors immediately switched her antibiotics and treatment.
I know doctors are busy. They treat so many patients during the day, and so often I did hear, oh, well, we've seen a lot of strep today. It's probably strep.
Dr. Patil agrees testing might help us preserve the antibiotics we already have and limit resistance.
We are having a nationwide shortage of antibiotics. Commonly prescribed antibiotics are in shortfall throughout the country, and that's a big problem in our state.
So, what happens if antibiotic resistance continues, or if additional antibiotics aren't developed?
We do not want to go back to dark ages. Commonly treated infections might become resistant, and we might have increased sickness and deaths from that.
According to the World Health Organization, pharmaceutical companies are developing new antibiotics, though, quote, none of them are expected to be effective against the most dangerous forms of antibiotic-resistant bacteria.
If you see, every year there is more diabetes drugs coming out, blood pressure, Alzheimer's, because there is a lot of money in those drugs. But whereas in antibiotics, there is not much money in it.
Although doctors are concerned about the overuse of antibiotics, Dr. Patil says for now, helping this problem comes down to 3 important things: proper diagnoses, reducing overprescriptions, and increasing awareness.
Antibiotics are a very valuable resource available to us, and we should try to preserve it as much as possible.
Now, we are here to help, so here are 4 other things that health experts say can help prevent antibiotic resistance. Number 1, don't take antibiotics for a virus. It won't work. And number 2, don't save an antibiotic for the next time you get sick. Never save it for later. Third, take them only as prescribed and make sure to finish your treatment even if you are feeling better. And finally, never take an antibiotic prescribed for someone else. If you want to see the list again, we'll post it online in the article for this story on THV11.com.